When should I consult a speech and language therapist? Hi everyone, I am Thasbih Amin, speech and language therapist working in Dubai. One of the common dilemmas faced by parents who suspect their child having a speech and language difficulty is, when should I consult a speech and language therapist? Should we intervene now, or is it something that would go away on its own? Will my family support me in this? Am I the only one who feels there's something wrong with my child? A million questions go through their mind. This is normal, and in fact, I feel this is good because you have observed your child and you want help. Many professionals, both in and outside the field of language pathology, are hesitant to label a child as having a language disorder before the third or even the fourth birthday. The reason being that a child with no significant birth history, with normal hearing, with normal motor development, which means the child crawled, sat, and walked normally, with normal social development, which means the child had good social smile, they were able to engage with others, they were able to play with others, and have good cognition skills, which means they were able to learn and understand using their senses. I do see a lot of parents in this category where the child does not have any additional risks other than the language delay. During this time, I facilitate a parent training with the parents where I teach them the language elicitation techniques to practice at home rather than come to me for a direct intervention. However, it is important to stay informed regarding the predictors or risk factors for language growth in children. First and foremost, please consult with your pediatrician. They will be able to guide you forward. These are the predictors of need for intervention. So we have language predictors and non-language predictors. Let's look at the language predictors at the beginning. The first language predictor is a small vocabulary size. The small vocabulary size is usually detected by parents when they go to birthday parties or social gatherings. Parents usually tell me that their child is not speaking as much as their cousins or their friends' children who are the same age. Usually, a child starts to speak first words between the time frame of 12 to 18 months of age. After that, there is a steady increase in vocabulary. By the time the child is 2 years of age, they are able to speak in two-word phrases. For example, Mummy come, Daddy sit. They are able to follow two-step instructions, pick up the book, put it on the table, and they have an average vocabulary of 200 to 300 words. Language comprehension. Children show difficulty in understanding what is being said to them. So, for example, a child who is 1 year old should be able to follow a one-step direction. For example, pick up the book. A child who is 2 years of age should be able to follow two-step directions. For example, pick up the book, put it on the table. By 3 years of age, they should be able to follow three-step instructions. For example, pick up the book, put it on the table, open the book. Speech sound errors or clarity of speech. By the time the child is 2 years old, their speech is 50% intelligible, which means that 50% of the time, people are able to understand what the child is trying to say. By 3 years, this becomes a 75% intelligible. And by 4 years, when the child is a preschooler, getting ready to go to school, their speech is 100% intelligible, which means people at home and people outside can follow the child perfectly. Imitation skills. The child is not able to imitate words or sounds as we talk to them. For example, children, as they are developing, when they hear a new word or when we say a new word, they try to imitate or they try to spontaneously imitate what we are trying to say. So children who are at risk will not be imitating these sounds or words as spontaneously as typically developing children. All these skills are important for the child to develop their communication. Play skills. If a child between the age of 2 to 3 years is still engaged in primitive play, like grasping and throwing, and not engaged in pretend play or symbolic play activities. For more on the types of play and the developmental stages of play, please watch my video about play. Gestures. The child is using very few gestures or not using gestures at all, like pointing and using words to communicate what they want. For more on this, please watch my video about gestures. Social skills. The child is having difficulty to initiate a social interaction, which means they come to the parent with something. They are not able to maintain eye contact or have that shared enjoyment with their parents. They are not able to engage with their same age groups or their peers, and if they have a lot of behavioral problems. Risk factors for language delays. A child with a significant birth history or who has an overall delay in terms of motor, social, cognition, and language. Children with recurrent ear infections. Between the age of 0 to 4 years, it is a significant period in terms of speech, language, and communication development. So, if your child has been exposed to recurrent ear infections, then it is a factor that need to be considered. Family history. If there is a strong family history from the father's or mother's side of having a speech and language delay, it should be taken into account. Boys are more vulnerable to speech and language difficulties than girls. Now that you know the predictors or risk factors for language growth, if you feel that your child has any of these factors or a combination of these, or you are in doubt, it is better to consult a speech and language therapist. Earlier, the better. For more information about the language and the non-language factors of a child's communication, please watch my video about the development of communication. Thank you very much for watching. I hope you enjoyed this video.